This video is all about large animals' intravascular catheterization. Prepare the material prior to the procedure. This is a sterile procedure in large animals. So you're gonna use a catheter, 14 gauge for a sheep, and a syringe of flush to check catheter patency, an injection cap, and a needle. You can use the envelope of the sterile gloves as a sterile field to lay out sterile material. For this, you're going to open the envelope by holding both sides and pulling them away from each other. This will open the packaging. To keep it open, you may want to fold the bottom of the envelope. And you're going to open your material sterilely by peeling off the paper back of the needle and dropping the needle on the sterile field. You may want to do the same with the injection cap. And then you're going to want to open the catheter packaging to remove the catheter from its protective plastic container. It may be difficult to have the catheter drop immediately, so you may want to move around the catheter with one of the plastic caps. And then you're going to prepare yourself facing your patient. So you're going to put one knee on the ground so that if the patient is moving, you can go away from the patient. Let's start by demonstrating how to place the IV catheter when you are right-handed. Your patient has been aseptically prepared. You hold off the vein at the level of the thoracic inlet with the thumb of your non-dominant hand. You hold the catheter between your thumb and your middle finger with your pointer on top of the cap. You insert the catheter at a 45-degree angle into the vein and you observe a flash of blood in the flash chamber. You're going to use your non-contaminated hand, your dominant hand, to push the catheter along the stylate until it meets the entry point of the skin. Your dirty hand is going to hold off the stylate in place. Then you're going to hold off the vein more proximally to the catheter, and you're going to place an injection cap. Now, let's see IV catheter placement for left-handed people. Similarly to the right-handed technique, you're going to hold your catheter by making sure that you're keeping together the catheter and the stylet. And so you're going to use for this your thumb, your middle finger, and your pointer on top of the cap of the catheter. I personally like to use also my ring finger to stabilize the catheter. You occlude the vein with the thumb of your non-dominant hand at the level of the thoracic inlet. Then, with a frank motion and with a 45-degree angle, keeping the bevel of the catheter towards yourself, you're going to insert the catheter towards the heart of the patient. You observe a flash of blood into the flash chamber. And then you're going to lower the angle of your catheter so that you can advance it a few more millimeters. Then you're going to switch hands and use your dominant clean hand to push the catheter along the stylet into the vein, while your dirty hand, which was occluding the vein, is holding the stylet in position. Once this is done, you can remove the stylet and then occluding the vein more proximally closer to the catheter. Then you can close the catheter with the injection cap. Before securing your catheter, make sure that the hub meets the entry point of the skin. You shouldn't see any part of the catheter. Then you're going to check catheter patency by flushing it with sterile saline. And you want to watch for subcutaneous leakage. Then you're going to secure the catheter in place. And so you're going to place the tape with the adhesive side facing up on the underside of the catheter hub with a tag of about 1.5 centimeter left to the side of the catheter. This is a one-wing catheter. Then you pass the suture through the needle, and for this, you're going to pass it from the tip of the needle. Don't try it from the hub, it's going to be too difficult. Make sure to not poke yourself while doing that. Then you want to hold the suture between your finger and pass the needle through the white tape butterfly from outside to inside on one side of the catheter. You may need to use some strands to go through the white tape, which is quite thick. Then you're going to pass the needle through the skin beneath the catheter and back out through the second white tape if you decided to do a two-wing taping. Here it's a one-wing tape, so you don't need to go back through a second white tape butterfly. To prevent inadvertent incision of the jugular vein, the skin can be pinched up away from the jugular. Hold the suture in place while removing the needle. With your non-dominant hand, make a C. Then take the suture under, then over your pointer finger to make an X. Pinch your fingers together. Then dive your thumb through the loop to move the loop from your pointer to your thumb. Then put the suture between your fingers and your thumb and flip it back through the loop. Pull your suture tight and your hands will be crossed. Return your hands to resting position without letting go of the suture. And your second throw is going off your thumb. So have the suture go under and then over your thumb of your non-dominant hand and make an X over your thumb. Pinch your thumb and your finger together and then move the loop from your thumb to your pointer finger. Put the suture between your thumb and your pointer finger and then flip it back through the loop. Pull tight. Do this again at least twice.